Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm an inventor of ASTR specialty. I'm also a cancer survivor and I used to suffer from chronic migraines, headache, pain and fatigue before I invented ASTR specialty. Right, Alex, tell me what happened to your jaw. How did you hurt your jaw? What's going on? And your headache?
There's not really a injury that occurred, but I've had head trauma in the past that may have caused it. Just continuous discomfort.
Where do you feel the pain?
Up top of my forehead, the two joints.
The two joints, okay. So you said you had a history of trauma. Did you have concussion? Did you have falls? What did you have?
Yeah, I've had 5 diagnosed concussions.
Okay. And where did you hit your head?
The first 2 were in the back of my head.
Okay.
And then the last 3 were side.
Which side?
I think both sides actually.
Okay, so those are actually a risk factor for TMJ issue. Okay, so that's happened. And how long you been having the headache and the jaw issue?
About 4 years now.
4 years. Okay. For the last 4 years, what kind of treatment you had for this?
No treatment.
You did not have physical therapy, chiropractor, or massage?
I started physical therapy a little bit this past year.
Okay.
It hasn't helped.
Alright, do you wear any night guard or anything?
Yeah, I have a night guard that I've been wearing for a year and a half now.
Okay. So how much you rate your tightness or pain or headache from 0 to 10? 10 is emergency room, 0 is nothing.
Tightness, probably an 8.
Okay.
Headache, 5 or 6.
Okay. And how often do you feel that? Do you feel that it's constant or comes and goes?
Every day.
Every day. So there's nothing like flare it up because you're constantly feeling that.
It's the constant feeling.
So how you describe your headache? Like, where do you feel it? Do you feel nauseous? Do you feel like vomit? Or you feel like sensitivity?
Headaches in the front of my head.
Okay.
I'll go through cycles where I do vomit. Yeah, just temples.
The temples?
And the front.
And do you feel like light sensitivity or noise sensitivity?
Noise sensitivity.
Okay, do you have the symptoms now or just the headache, the pressure?
Just the pressure.
Okay, do you feel it behind your eyes too? Or just the front or here?
Just the front of my head.
Okay. Anything going on in your neck, any pain or tightness?
Neck tightness. No, not really any pain.
Okay. So is your jaw is worse or your neck?
My jaw.
Or both? Okay. So do you have any clicking, grinding, like limitation in range of motion in your jaw, or it's okay?
Mostly just the clicking. I don't think I really grind that much.
Okay. Do you feel you're limited in your range of motion in your jaw?
I think my range of motion is
fine.
Okay, yeah.
Okay. So let's set up a nice and tall. I want you to open your jaw and close, and how much tightness you feel with that. Okay, how often it's click like this?
Every other time.
Does it click on one side or both? Alternate.
Alternates.
Okay, so every time you open it, it click like this?
Yeah.
Let's do it one more time. Okay, let me see your range of motion for your neck. You're going to turn left and right. How's that? And back. And forward. How does that feel?
This definitely goes back further. On this side it feels clogged.
Okay, what you feel it on the side?
I can't.
You cannot go
it's
further.
Like stop, you know.
And side bend left and right. Side bend here is okay. It's a little bit tight on the other side.
Yeah.
Okay. Alright, so everything pain-free. Is that painful? It's okay.
Yeah, you're fine.
Okay. Is your pain more in certain time or just a constant?
It's just constant. Just want to increase blood flow, right?
No, and what I'm working on now is the fascia. Okay, so we have a system called fascia, the super layer wrapping the entire body, very thin layer that's wrapping this the entire body. This is superficial fascia. It's like a Spider-Man suit. So when you have fascia restriction, it's like you're wearing a t-shirt 2 to 3 size too small, and that's what I'm trying to release, because when it's tight, it's actually compressing here.
Like,
So
definitely
this
can
is
feel
this
it.
is normal fascia movement. You feel the mobility
Yeah.
here? Okay, compared to this, that's not moving. So that's basically compression there. So what I'm doing is not increasing the blood flow, it's releasing. Because anything can increase the blood flow. Massage can increase the blood flow. That doesn't mean it's healing. That doesn't mean it's treating the issue. So what I'm doing is actually releasing that fascia restriction, that compressing there. You feel the tightness here?
Yeah,
Okay, so I'm gonna
but I can
release it.
also feel like it's been released a little bit.
Yeah, you will feel it.
I definitely feel a
release.
difference.
You will feel increased blood flow. You will
Yeah.
feel warmness, because when your fascia is tight, it's like compressing on everything else.
Yeah.
So yeah, definitely that's will decrease blood flow. But it's the tightness decreasing the blood flow. So when it's released, everything is loose, so everything flowing, flying. Is it too much?
No, you're fine.
Okay. So the water is on the side or in the front here? The tightness.
Probably the front.
In the front, in here, yeah. I'm gonna give you some water. I'll just focus on your jaw for now, okay? Just to get it under control, and maybe later we'll do the neck, okay? Any discomfort with that?
Nah.
Okay. Is it okay? I will work inside your mouth.
Yeah, that's fine.
Okay. Okay. Open your mouth. Close. Any pain with that, or it's okay?
It's fine.
Okay.
I think it's like
Sure.
kind of.
You feel the tightness there?
Yeah.
Okay. That's really tight. So I'm actually, and you will notice when I release that, it can have more mobility. Okay. And you said you have sinus infection?
Yeah.
Okay. Okay, you feel the movement now?
Yeah.
I just release your fascia now, the internal fascia. Okay. Is that too much? It's okay. Okay, this side is not as bad as the other side. I want
Really?
you- yeah.
How it works.
Let's sit up. I can give you some water. So how is that? You still feel it, or the tightness is gone?
I mean, it's weird that you say this one was tighter. It just feels like it gets jammed up over here.
In here, you still feel tightness there?
Where it pops differently than this side. It's more of a harder.
I feel a lot of scar tissue. Both sides, but more scar tissue here. Fascia, more fascia
Yeah,
restriction.
this one, it feels like a buildup of, I don't know.
Scar tissue. I will show you the scar tissue actually now. You're gonna feel the knot. So you're gonna feel cold, okay?
My
Good ocean.
front head though feels a little better.
Yeah, that's good.
I mean, like it feels like it's been released.
So it's let me show you. You can close your eyes or just relax. You feel that? You feel that bump here?
Yeah.
That's a scar tissue here. Okay, if you don't have a scar tissue, let me show you here. Feel how nice and smooth here?
Yeah.
There's nothing compared to this.
Oh god.
You feel that?
Yeah.
That's a lot of scar tissue here. Here, you feel this? It's like a grain here and here like a knot, like a piece of rock. Feel that? And I will not be surprised if you have more on the other side. Sorry. Make sure it's not painful.
Nah, it just feels weird.
And here I can see the tools is like
Yeah.
going like up and down. Like this, feel that? And you feel that, oh, that's a lot of scar tissue. I'm not surprised you have that clicking because that's the scar tissue gonna limit your range of motion in this area. Is that too much here?
No, it's fine.
You feel that here? Yeah, that's one. Here, feel this. And you sit in the joint itself, yes, so you're gonna work in here. How's that? How's it feel?
It's fine. I mean, it feels terrible, but there's no pain.
Yeah, it's not pain. It feels terrible.
It just, I can hear it.
the scar tissue.
Yeah.
It's a bad. It's not painful, isn't it?
No, no.
It's just terrible to hear the sound of the
Yeah.
scar tissue. You know, the scar tissue is talking.
Yeah.
That's very typical. With this tool, it's the design and the material help actually to hear the scar tissue, so it will be able to detect it. Because here,
That's crazy.
nothing. There's nothing, and you start here, you start to hear the crunching. That's a good feedback about the size of the scar tissue, and here more. In this area, you feel this,
Yeah.
like not here. I'm not surprised with all your history of trauma that you'll have all that scar tissue. So anytime you had injury, your body, like you had a micro tear in that area, so your body started to build a scar tissue. But over time, you have several trauma, and instead if you have one layer of scar tissue, you have 50 layers of scar tissue. So you start to feel like a big knot. And when that happens, because our muscle should act like a rubber band when contract and relax, scar tissues feel like a knot in a rubber band. So when your muscle contract, it does not stretch much. and that's what shifts your jaw, so you start to have more clicking.
I mean, the shift to my jaw is not. Is that bad?
Well, think about your car out of alignment. You're gonna wear your tires more
Oh, so
on one side.
it's out of alignment right now.
Well, that clicking,
Or just
it's
opening.
especially you have slight deviation. That's mean your muscles not contracting evenly, and you have a little bit tilt. So the goal is actually to keep everything symmetrical as possible. If you still feel the sound, that's not my concern now. Over time, we're gonna release everything. The sound should be decreased. My concern now is your constant tightness and symptoms that we need to break this vicious cycle and then clean up everything else after that. How's that? The tightness from 0 to 10.
Maybe like a 6.
Where do you feel it?
Up here.
Both sides?
More on this
Deep?
side.
How
Deep,
about overall? So what I'm looking for, okay.
This up here definitely went down.
So what I'm looking for is the size and the intensity. So before it used to be the whole thing. Okay. Now, is it spots or still feel like in more areas? And where is the spots?
It's the joint right here.
The joint itself.
Yeah, and then just coming down in here.
Both sides on those two spots.
Back here too. I don't know what that.
Yeah. How much from 0 to 10?
Probably like a 7.
How's that?
Feels fine.
In the back in here or here?
It's like lower up there to down low.
Mm-hmm. I'll show you the scar tissue in this area. You feel those here? That's a scar tissue too. You feel that bumpy here?
Yeah.
Okay, stir up for me. Give me some water until we have it. And where do you feel it?
I mean, my head definitely feels lighter.
Okay, let's drink a
Like
little bit.
not a lot of pressure, you know.
Let's drink a little bit more water. You still feel it or it's gone? In the front and...
I feel like it's getting a little jammed up on this right side.
Mhm.
I don't know.
What about the other side?
I feel like it feels like it's functioning normally on this side, but it doesn't feel like it's...
Okay. So, do you have seizure or pacemaker or anything like that?
No.
Okay. So, I worked on a proliferation now, and I'm gonna start work on an inflammation because it seemed that you have a little bit inflammation there. So I'm gonna use one magnet to see if it's mild or severe. If you respond to one magnet, it's mild local inflammation. If not, I'm gonna use two magnets. So I just wanna test how severe is your inflammation.
Okay.
Okay? So we'll have you lie on your back, head here. No, it's not bad. Okay. So I'm actually gonna... How does it feel?
Fine.
Okay. I'm really doing it on the joint itself because you have that clicking. Very interesting to see. So this magnet, I designed it with the anti-inflammatory coating on it. And it's a very strong magnet that should penetrate around 2 inches to 2 inches and a half when I use one magnet. When I use both of them, the range vary from 4 to 5 inches. So that's why I want to try just the less intense magnet, and then we'll see how we respond to it. How does that feel?
I mean, I don't really feel it's...
Okay.
Am I supposed to feel something?
Some patient can feel the release while we're doing it. Others, that just you need to change the position, and we'll have you open your jaw and see it. You know. How's the headache? Did you feel headache or it was gone?
My whole face feels better.
Okay, that's good. So how does that feel working inside your mouth now? Can you tell the difference?
Yeah, it feels... I mean, it's still there, but I do feel a difference.
What the difference?
But then again,
you
it's
feel?
like kind of like throbbing right now.
Throbbing? Let's drink a little bit more
yeah.
water. Do you still feel the pressure of my hands, or you feel the tightness that originally you feel it?
I still feel the tightness that I originally felt.
The original feel it? Okay. How much from 0 to 10 now?
5.
And what about the headache?
I haven't even thought about my head, so I guess better.
That's good. So let me do one more thing. Lie on your back again. You gotta do the magnet again. But this time, because I did that release, I just wanna see how you feel. You feel it deep inside, yeah?
Yeah.
Okay, so up and drink a little bit more water. And tell me how that feel. How's that? Tightness.
About the same.
Mm-hmm.
Opening though,
Mm-hmm.
like right
Mm-hmm.
under here more.
Mm-hmm.
I think on both sides, but more.
Just localize. It's not all over like what you were.
Yeah, it's
explaining.
definitely not
Okay.
all together in
All
one
together.
now.
So it
It's
start
kinda
to
like,
shrink.
It's like separate in different spots now.
Okay, that's a good
Does that
sign.
make sense?
That's a good sign. That's mean.
It's not like a whole bundle anymore.
That's a good sign. So yeah, we definitely need to work on it a little bit more. So okay, all right, Alex. So today, can you tell me how do you feel? How many visits you had so far, and just a progress about your headache and jaw pain and neck pain.
So it's been 4 visits now,
Mm-hmm.
and I think the first 2 visits I
Mhm.
wasn't really taking
Mm-hmm.
the exercises and all the other advice, following the program
Mhm.
seriously, but
Mm-hmm.
I began to take that seriously,
Mm-hmm.
and I've seen a lot of improvement.
Mm-hmm.
A lot of inflammation has gone down.
Okay.
Yeah.
So, how much pain do you feel now? Do you have any symptoms? Are you back to normal? It's just a progress about how you're doing.
I'm definitely not back to normal.
Okay.
I still
If we say like 100% back to normal, how far?
probably at 80 to 85%,
85%. That's not bad.
which is
Mm-hmm.
really good for
Mhm.
me because I think I was at
Mm-hmm.
10%. I was just feeling
Mm-hmm.
pretty bad.
Yeah, and it was affecting a lot of your function. Yeah.
Yeah, definitely
Mm-hmm.
it was affecting my daily
Mm-hmm.
activities, function,
Mm-hmm.
mentality.
How long this been going on before you come?
3 to 4 years.
3 to 4 years, and what treatment you had before?
I've had just regular TMJ physical therapy, which
Mhm.
did not work at all.
Mm-hmm.
What's that?
Did you have chiropractor massage?
I've had a chiropractor.
Mm-hmm.
Yeah, chiropractor and
Mhm.
physical therapy.
Yeah. Mm-hmm. So what do you think about the ASTR treatment? You had all of that, and you had that issue for 3-4 years. So, what your thought about the ASTR treatment after like 4 visits?
I think it's amazing. It's
Mhm.
something way different.
Mm-hmm.
Something that you wouldn't expect
Mm-hmm.
that actually works.
Mm-hmm.
And it's so simple at the same time.
That's good. Well, as long as it works. Yeah, awesome. Yeah, thank you so much.
Yeah.
Thank you. Thank you. Feel free to subscribe to my channel to get helpful tips on how to relieve pain and watch real treatment videos. There are over 45 studies that support ASTR treatment model. If you are a patient and would like to schedule an appointment or treat yourself at home, check the link below. If you are a healthcare provider and would like to receive ASTR training and buy ASTR instrument, check the link below. See you soon!